Hi everyone, welcome to CAPSA. Today we will discuss about mydriasis, miosis and cycloplegia. Okay, so mydriasis is a condition where pupillary dilation occurs. It means when there is increasing darkness, mydriasis occurs. But in the miosis, what happens? In the miosis, when there is increasing brightness, pupillary constriction occur. It means it leads to miosis. Now, cycloplegia is a condition which causes loss of accommodation and blurred vision. So, when we are using the drug which causes mydriasis, that is called Mydriatics drug. When we are using drugs which causes miosis, that drug is known as Miotics, and similarly Cycloplegics. Okay. Now, which kind of receptors are involved for these three actions? That is alpha 1, alpha 2 and M3, muscarinic receptor, adrenoreceptors. Okay. Now, drugs classifications which shows the cycloplegic actions, that is parasympatholytic or parasympathetic antagonist, means M3 antagonist. Okay. Now we need to be clear about which kind of parasympathetic antagonist or muscarinic antagonist act as mydriatics. Okay. These are cyclopentolate, tropicamide and atropine. Okay. This kind of parasympatholytic shows the mydriatics action and cycloplegic actions. Okay. And for mydriatics, sympathomimetics which are used, it means alpha 1, alpha 2 receptor agonists. It shows the direct action. Okay. This kind of sympathomimetics are phenylephrine. Okay. Now, for miotics action, parasympathomimetics are used. For mydriatics, parasympatholytic or antagonist are used, and for miotic action, parasympathomimetics or means M3 receptor agonists are used. Okay. For this purpose, this kind of drugs are Pilocarpine and carbachol. Percentage is very much important. Cyclopentolate is 0.5 to 1% used, but tropicamide used is 0.5 to 1%. Atropine always used 0.5% to 1%. And phenylephrine that is used is 2.5% to 10%. Okay. Now, what are the uses? Okay. So, Mydriatics actually used for fundus examination in children. Okay. For fundus examination, the preferable drug is phenylephrine. For cycloplegic action, that is cycloplegics actually used for refractive error and relief in pain in iridocyclitis. So, iridocyclitis is a condition where your iris and ciliary muscle gets into an inflamed condition or inflamed condition of iris and your ciliary body or ciliary muscles. Okay. So, for this purpose, refractive error and relief in pain in iridocyclitis, the medicine which is used is cyclopentolate and tropicamide. These are preferable. But for children, to examine the refractive error, used is atropine. So, atropine is the choice of drug for children which age is less than 5 years. You need to keep in mind. Okay. Now, for the treatment of glaucoma, obviously myotics are used. The best drug is pilocarpine. Drug of choice is pilocarpine, which is used in the treatment of myotics. Sorry, glaucoma. Okay. Now, how the conditions look like. So, this is your mydriasis. This is miosis. This is the pupil. You can see here that pupillary dilation is occurs in mydriasis and pupillary constriction is occurred in miosis. Okay. And what is pupil? Pupil is an opening in the center of the iris through which light enters to the eye. Okay. So that is the clear concept about myotics or miosis, cycloplegics and mydriatics or mydriasis. Okay. That is very much important for your exam point of view. If you like my lecture, please do like, comment, share and subscribe. Thank you for your attention.